is Sebastian Funk from the London School. And he's going to talk about estimates of COVID-19 transmission intensity and forecasts.
Once we're getting set up, I can get started by offering a great thanks to the organizers. I think it's already a fantastic meeting. It's absolutely spectacular to be back here. You all haven't changed a bit, those that were here 10 years ago. And I will talk about, so in kind of this, thinking about a session on policy and international modeling or whatever it was, I will talk to you about one particular piece of work we did during the COVID pandemic, which I think had some interesting implications for how we now think about responding to future threats. And I will motivate the talk with this quote that I very much like and that I often refer to by Hans Rosling when he was working with the Liberian, Hans Rosling, epidemiologist, working with the Liberian Ministry of Health in the 2014 Ebola outbreak. And there's this statement where he says, we were losing ourselves in details, and all we needed to know is, are the number of cases rising, falling, or leveling off? And what might seem like quite a trivial statement is actually, I think, quite intricate. And if you think about it in mathematical terms, so we want to know whether things are rising, falling, or leveling off. So we want to know the first derivative. And we want to know this now. We want to know whether it is falling or leveling off. So we're trying to estimate the first derivative of a curve that ends at the present time. Of course, that isn't defined unless we can somehow extend that curve into the future. And so we can connect this seemingly trivial statement, which is actually quite intricate, to some real-time modeling procedures or methods. So things like nowcasting for what is the current number of cases taking into account partial observations. This question of whether the number is rising, falling, leveling off, you could relate that maybe to estimating a reproduction number. And then what the implications are for the future is then a forecast. And of course, as I already kind of hinted at, you already need the forecast to do the RT estimation for the current point in time. And you're trying to do that with case data that often looks like that. And so again, what might seem like a trivial statement that we want to, all we need to know is this going up or down or not. Often you have these features in the data such as no reporting on the weekends. You have this here in USS, yeah. So here it seems Saturday, Sunday missing, Saturday, Sunday missing. And then here all of a sudden there is reporting Saturday, Sunday, and then here there's just one day missing, and then you might have these partial observations. So in this moment in time, saying whether this is going up or down or staying constant is actually not a trivial question, and something that, however, we can answer with models. And that brings me to what we did in COVID-19 very much related to that, and that is trying to estimate reproduction numbers and then using them for, or in the same context, performing nowcasts and forecasts for case series from a variety of countries. That work started in end of January looking at China, data from China that was emerging under several zero-interval distribution assumptions. We then expanded that in early March to look at all the countries that we were able to get data from, which are the ones colored in the map here. And from then on, that work was very much led by Sam Abbott. So that applies to the following work that I'm presenting here as well. In August, we further expanded that into a fully fledged dashboard, a website which had daily updates and provided information using case data provided by Johns Hopkins University to create daily updates of the reproduction number in pretty much all the countries of the world, as well as some subnational entities, and nowcasts and forecasts. All of this was done using a generative Bayesian model. So I mentioned delays, I mentioned reporting issues. So in this model, we have latent number of infections that are related to past infections via the renewal equation and a generation time. From that, we can estimate the reproduction number, but we also need to somehow take into account that the reproduction number tends to vary slowly, and we do that by linking the first differences of the reproduction number on the log scale with a Gaussian process, and then we also take into account reporting delays and weekly reporting effects. The whole thing is implemented in Stan, and I went through this really quickly, but you get outputs like this, where you get in bars here the case series, you get an estimate of latent infections that come from the delays, and you get an estimate of the reproduction number, which, as the data becomes less informative towards the present, and because we don't have future data, expands its uncertainty towards the present, but gives an estimate for what the reproduction number might be now, based on this data. And doing all of that daily for all the countries in the world required quite a lot of computation. So we received some help, and received some help from a very generous grant from Microsoft. And then also we received some software engineering help from the Met Office, the UK National Weather Forecasting Service, which seemed like a natural fit given that their job is to produce daily estimates and forecasts. And in fact, some of their contributions turned out to be quite useful. And again, I'm going through this quite quickly, and then I get to the bit that I think is more interesting, which is the challenges that we encountered and the impacts that we had. Just want to mention that there was an associated R package, which we wrote, again, that was led by Sam Abbott, called EpiNow2. We also somehow had to process all this data, and we created an R package for accessing various data sources for all these national data, that came from Johns Hopkins, but then also subnational data. And the idea was very much that this was an open global dashboard, and anybody who wanted to contribute subnational estimates for, say, their particular country could do so via adding a function to this R package that would download the data for that country from somewhere and prepare it in a certain format that required. That would then just be added via all this software engineering that was done mostly by the Met Office, would be added more or less automatically to the website, and so people would be able to access estimates for entity or subnational areas that weren't at that time on the website. And there's one example, for example, that we had from Colombia. All of these were then also displayed on the website. And we didn't just show all this data, but we also stored all this data on GitHub as daily estimates, so to have some kind of digital downloadable version of that people could use for further processing. And that brings me to what I really wanted to talk about, which I think is maybe the more interesting bit, which is reflecting on all this work, which is a huge amount of work, and we provided daily estimates on this website between March 2020 and March 2022, what the challenges were that we encountered, and that maybe lead us to think about what we might want to do different next time, if we ever want to do anything like that ever again. And the first challenge was on methodology. And in fact, I haven't shown you that originally. I showed you that kind of nice model, which is the one that we ended up with in August 2020, fully generative Bayesian model with everything connected. We initially had a different model, which was implemented in the EpiNow R package, hence the name EpiNow2 for the other one, where we took into account delays in a way that we then learned was fundamentally flawed, where we worked from the case data back to incidence data via some just not right back calculation procedure, and then used an existing R package, EpiEstim, to work with the infections. And then some others, it was interesting because some others had similar insights during the early part of the pandemic, and then ended up being a publication led by Caitlin Gostick, where we talked about kind of these typical mistakes that several of us made at the same time in measuring the effective reproduction number, and particularly in taking into account these delays. But so one challenge was that we didn't, at the time when the pandemic started, have a tool ready that was ready to work with the data that we had, which had delays. I mean, it's pretty standard, you would think, that you have a delay from infection to observation, and that we don't normally have data reported by infection time, as well as these other potential reporting artifacts. Okay, the second challenge is that when you provide a global dashboard, and through that, we were devoid of local context. So we didn't have the local context for the data, but also we were working with one incubation period, generation time, local interventions might change the generation time. Generation times change depending on the variant mix that you might have in a certain country. All of that we didn't take into account. So in that sense, the whole thing was fundamentally flawed from that perspective anyway. And we did actually, I mean, again, we had this kind of idea that we were aware of this, and we provided for an ability in the model that was run daily to set different values of the parameters, also the reporting delays, those kind of things that go in for the different countries. And we had this kind of maybe naive vision that we could have people contributing from different countries, or we could maybe collate values for different countries, try to use the global line list. There was global.health, was an organization that provided a global line list that turned out quite biased as well. In the end, we didn't end up doing anything on this. And so we were stuck with this lack of local context and had to deal with that. Which then led to things like this, which is the communications challenge, which is that we had a lot of people contacting us or publicly commenting on the estimates that we showed. And sometimes things like a change in reporting could just break the model in a way that you could have in the state of the United States, for example, more new cases than there are residents. Leading sometimes to some considerable level of consternation and anger. Another thing that we really didn't foresee, so some of the inspiration for doing this work came from work that we previously did during the Ebola epidemic in West Africa, where we also maintained a global dashboard that we had a lot of feedback on that was really useful, and it was used for various situational reports and everything. It turned out that the idea for doing this was not particularly unique, and in fact, there was a proliferation of dashboards for reproduction numbers and the like, and through that, a vast duplication of effort. So there was this, this RT dashboard up here, which was created by the founder of Twitter, whose name escapes me now. Our World in Data, which had kind of fantastic visualization of data. Also, at some point much later, started including reproduction numbers. And other R packages doing the same as our R packages also came up. And we tried a little bit, and others tried to kind of connect these efforts and see whether there's any way that we can maybe work together to improve things, but for a variety of reasons, that never really happened. And so ultimately, many of these efforts, including potentially ours, were wasted because someone else did exactly the same thing. There's a really interesting paper by Brockhaus and others came out last year on these using some of these different reproduction number trajectories from different websites and groups that provided them, and trying to break down what explained differences in them. And it found that you can explain most of the differences between these different estimates in differences in the parameters used. So you have use a different reporting delay and a different generation time. Once you account for that, they pretty much all use renewal equation models, and once you account for that, you end up with pretty much the same estimate from everyone. Maybe the biggest challenge underlying all of that was our complete lack of capacity for doing this properly. And many of these issues that I've mentioned could have been in principle corrected for, so we could have gone out and sourced more local parameters, etc. But we didn't. And on the flip side, we were, like many others as well, vastly overworked with, at times, serious consequences to individual well-being. And some of this is summarized in this, I think, quite nice article based on a workshop that Kath Sherratt and Anna Carnegie and others organized on kind of the implications of having been involved in the modeling response in the UK on individual experiences and communities. Okay, so these are all the challenges. Let's talk about some positive stuff, which is some of the impact that this work that we did had. And I'll start by listing a few things, and then I'll comment on some of this. So first of all, some of these estimates were used by other researchers. So they were either used in subsequent analyses. So as I said, we put these kind of daily estimates of reproduction numbers on GitHub to be downloadable, and various others use these data sets either in further modeling, which maybe the statistician in us will scoff at and is not really particularly advisable procedure, but sometimes the only thing you can do because you can't put everything into a joint model. And so people looked at things like impact of interventions using these and various other things. Again, there was a challenge there in that none of these reached out in advance to us in terms of whether we thought it was a sensible thing to do, or whether there were any limitations in the data or anything that they should be aware of. But that's fine. I mean, that was partly the idea in putting this stuff out there, is that we wouldn't have to interact with everyone who wanted to use these estimates, and that we provide a research that would be potentially of use to others. We also did some of this stuff that I just said wasn't advisable ourselves, and particularly when it came to assessing the impact of new variants and their transmission advantage. We did some of these plots using these estimates that were already generated, so we kind of didn't have to create a new model, but we could just use the already existing estimates to monitor. For example, here you see the emergence of alpha. This was here S-gene target failure proportion, so this is some indication. Each of these dots is a local area in the UK. And in the UK, of course, we had the advantage that we did understand the data better, and we did interact with policymakers. But here you can see that this is the early emergence of the alpha variant here, so you get the highest reproduction number in these local areas in Kent that also had the highest level of S-gene failure, or the highest levels of alpha. We did the same thing for delta and various other things. But then really we were thinking that this would be used by public health agencies, and we don't know all the users, and some of these have come up quite serendipitously, such as when we closed down the website in March 2022, we received an email a week later by the WHO saying, where are the estimates? And we just had no idea. We saw these crop up on some dashboards. We know that Microsoft, who so generously helped us, use these estimates in their own presentations. They were somehow connected to the White House, and they used these estimates. So we had similar kind of emails from them in 2020 saying, where are these estimates, which then became more urgent after they had given us the money to actually run them. And but this is in the nature of how we set this up. We had no way of tracking impact, really. So these are kind of the things that we knew about. There may have been some others that we didn't. And in that sense, and that's maybe what I said earlier, I think maybe it's an example that has some interesting features, because we didn't engage with policymakers in advance. We wanted to create this as a resource, but unlike some other work that we did during COVID, we then had no kind of direct interaction with the users necessarily. And that brings me to the last bit, which is what we can potentially learn from all of this. And I don't have a lot there, sorry. There's some small bits on what we now think are future directions and what we're trying to do. And the question of whether, I mean, we're still trying to answer the question whether any of this was worth it and whether we do it again. And I think this is an honest a question that we need to try and answer honestly. And I'd rather know if it was pointless than celebrate our successes if they weren't actually there. But one is, and it's great that Mike Plank is here somewhere, because I think one really nice example of maybe how this could be done better is the occasions, and this is one particular publication where people used our tool, the EpiNow2 model, on their data, but then kind of in full control of the data and the estimates and being able to cater for local circumstances, rather than we running it on some data downloaded from somewhere for them. And we had similar other interactions also with government of Ontario. It was mostly local governments that we interacted with in this way. And because of that, I think in some cases, maybe creating the tools to do this kind of work is more impactful and more sensible than actually doing it ourselves based on potentially biased and flawed data. And there are quite a lot of initiatives, and most of which we're in some way or the other involved. There's the Epiverse initiative from data.org, the new WHO hub for pandemic, maybe not so new anymore, Pandemic and Endemic Intelligence in Berlin, which is trying to bring together kind of a lot of these efforts to create tools. CDC, CFA, or CDC has a new, also not so new anymore perhaps, forecasting center for future pandemics, the CFA, which is doing more than just forecasting, but that's what it was deemed at in April 2022. And there's the EpiNowcast community, which is what Sam Abbott now runs, and is trying to have a more kind of community-led approach. And I think it's actually great to see these different attempts to create sustainable resources, and I don't know which of these will stick or be successful, but hopefully some or the other will. And then the other point I wanted to touch on is that For us, I think it was a useful exercise to try to think retrospectively whether this work was valuable or useful. And perhaps this is something we can think about more broadly in terms of modeling to inform policy that we do. And what I really don't know is how the value of modeling work relates to these kind of three, you could maybe break it down in three issues, to the quality. So did it make a difference in the kind of the impacts that we had, whether our estimates were biased or not? Were they too biased, or were they just about okay? There's a statement from our former chief medical director, chief medical officer, which is that 80% of the correct answer is immediately is more valuable than the fully correct answer later. But what does 80% mean here? How good does the quality need to be in order for it to be valuable? The second point then is relevance. Are you actually trying to answer the right question? Were we trying to answer the right question? Was there any point in that from that direction? And then the last one is communication. So does it matter if your estimates are of excellent quality if you're not communicating them properly? Or likewise, if you're a fantastic communicator, maybe you can get away with things that are broadly right. Who knows? And I think it's worth thinking about how we can perhaps develop some sort of way to evaluate modeling work, and we've done some kind of initial steps in that direction. We're doing some reviews of the literature. Lisa, who's here, Lisa Hadley, run a great interview project that touches on some of these aspects. And together with the World Health Organization, we're organizing a workshop in Berlin, which is by invitation only, but if you're interested in joining or know someone who does work in this area and has something to contribute, then it would be great to hear about that. And with that, I'm just left to remind you of the quote that motivated all of this, and to thank you for your attention, to thank, I think, specifically Sam Abbott for all the great work he did on this. We have a blog post on this, and I can put, there's a link to the slides. I can also put this on the Slack. We have a blog post where we go into this into a little bit more detail, but thank you all for listening to me.
Thank you for a very frank assessment of what was and didn't. Any questions?
So, thank you. Really very interesting to hear your reflection on it. But in the George Box famous quote that all models are wrong, but some are useful, whether or not a model is useful is not determined by us. We could look at models and think, oh, this is really useful, but actually it's the policymakers who decide whether a model is useful. And so your kind of last slide is really saying, well, you know, the model was wrong, because they always are, but was it useful? And you're asking questions. And actually, one of the things that's missing from this environment, apart from tomorrow when Fergus Cummings joins us from the policy side, is we don't have a policy input. Because the questions you're asking about the modelling really can only be answered by people like WHO. If they're complaining that when you took it down, then they're the ones who can tell you why it was useful and what, you know, answer those questions about accuracy and usefulness.
So that's a compelling point, but I think there's a counter-argument, which is that it's not our role to pay lip service to give decision makers what they want to hear, right? So that to me is the danger, and I think it's a useful and important approach to ask the people who we're trying to inform whether it was useful, but I don't think it gives us the whole answer. Because we might be giving the wrong answer, but it was politically expedient. And so this is why I think there's, so what you're touching at is what I would call relevance. Yeah? So is it the policymaker that someone needs answering? But then how much the quality then matters, and how much it matters to give them the correct answer that is useful, but perhaps not what the political thoughts are aligned with already, and therefore it is deemed later as not useful because it's brushed aside. I think that is something that we may require a little bit deeper investigation.
One more?
My question is about the inference method that you use on your AP-Now package. Is it like particle MCMC, or like which kind of method?
Right, so it's written in Stan, so it uses the inference methods provided by Stan. So just to, so it's implemented in Stan. Stan mostly uses Hamiltonian Monte Carlo method.
Well, I think we need to move on.
Yeah, great.
Let's-